Hi everyone, this video is going to discuss undocumented Latinos and their access to healthcare. The following presentation is created and presented by Gabriela Waas, Heidi James, Mariah Rodriguez, and Rosa Echeverria. After watching this presentation, the class will be able to give 3 reasons or barriers on why undocumented individuals are unable to access healthcare, be able to provide 3 resources undocumented individuals can refer to gain access to healthcare, as well as show understanding of the barriers the Hispanic Latino undocumented population face, why they don't have health care, how this could lead to more severe health issues, and how it affects society as a whole.
Having access to healthcare is important in promoting and maintaining health, preventing and managing disease, reducing unnecessary disability and premature death, and according to Healthy People 2020, access to comprehensive quality care is important for maintaining health. Some barriers to health services include high cost of care, inadequate health coverage, lack of services, and culturally competent care. And according to Healthy People Mid-Course Review, there are significant disparities in access by sex, age, race, ethnicity, education, and family income. The topic about if the U.S. should provide health services to undocumented immigrants has been a huge topic of debate, especially in the recent years. Human rights frameworks support universal access to healthcare, and neoliberals argue that it is up to the individual's responsibility for the access of healthcare. The 2010 Patient Protection and Affordable Care Act was signed into law with the sole purpose of providing accessible and affordable health coverage to the uninsured in the United States. The Affordable Care Act was in fact not universal, and it created a barrier to undocumented individuals from any type of government-based medical. 11 million undocumented individuals were left out of this act. 70% of them were Latino, and out of those 76%, 59 were Mexican. Undocumented immigrants are still left out and are not eligible for any federally funded health insurance programs in the United States.
The Hispanic population hold about 18.1% of the U.S. population and are expected to grow and increase to 28.6% by 2060. The Hispanic population were also the largest ethnic minority in the United States in 2004. So Hispanics are disproportionately affected by poor conditions in daily life that is shaped by social determinants of health, which include cultural values, income, education, and jobs, which can lead to stress, making this population even more vulnerable to diseases. So undocumented immigrants have limited options of how to get their health care. They can get their health care through free clinics that are available to provide, but it relies heavily on the location and if these resources are provided near you and if you are aware of it. If not, it leaves this population with no health care or health insurance. Individuals with no documents aren't able to get public health insurance program that is provided to citizens, such as Medicare, Medicaid, Children's Health Insurance Program, or the Affordable Care Act. So although immigrants don't have access to public health insurance programs, there is the 1986 Emergency Medical Treatment and Active Labor Act, which gives emergency access to anyone in the U.S. regardless of legal status and ability to pay. So this basically means if an undocumented immigrant goes into the emergency room for care, they will receive it.
In order to serve and care for undocumented Latinos, it is important to know that there are specific aspects to providing competent care. One way is to understand the common cultural beliefs and values the Latino population has, such as gender roles, the value of family, and seeking traditional medical practices like home remedies. Home remedies are a very popular way in the Latino community to heal themselves, so that's why they don't really turn to healthcare or going to the doctor as much. Another important aspect is speaking Spanish or simply having a translator present when there are Latino immigrants present. Most Latino immigrants have very poor English speaking skills and understanding skills as well. And if their provider is unable to communicate with them in their preferred language, it could lead to the progression of diseases rather than the termination. This barrier prevents Latinos from communicating all of their questions and concerns, which ultimately leads them to not getting the effective healthcare services that they need. So some barriers faced when trying to access healthcare for the Spanish-speaking population of Latinos. English language barriers can affect the quality of care received due to poor communication with healthcare professionals and doctors. So like I had mentioned in the cultural competence slide, it is very important for these Latino immigrants to be able to speak in their preferred language to communicate properly, or also leads to poor communication that leads to lots of misinformation, like not fully describing disease symptoms, improper understanding of medication instructions, patient chart inaccuracy, etc., which all result in ineffective treatment and or disease prevention. So another barrier is the Affordable Care Act. The Affordable Care Act provided health insurance for the first time to many who have never had health insurance before. However, it did not provide any for undocumented immigrants and those who are documented but have not had legal status for 5 years or more. This prevented Latino immigrants and Latinos in general from obtaining health insurance and the opportunity to finally get usual healthcare services for the first time. Another barrier is the fear of deportation. When going to apply for Medicaid, many families are hesitant because they are worried that their residency here in the U.S. will be compromised if they enroll to get such health care. With the recent things going on in today's society, deportation has become much more prevalent and it's more likely to happen, so that's why they are very afraid, and it just overall prevents them from getting the healthcare services that they need. Another barrier would be the utilization of emergency department services only. So according to the Emergency Medical Treatment and Labor Act, no person is denied to emergency room services and available to all, no matter their status. So because of this act, Latinos tend to utilize this service when it is absolutely necessary and neglect going to see providers on a regular basis. This can cause chronic diseases to be diagnosed at a much later stage or go undiagnosed at all due to the lack of usual healthcare source.
According to the U.S. Department of Health and Human Services, 20.6% of people under the age of 65 have no health insurance in this population. 9.8% of the Hispanics of all ages are in fair or poor health. And according to the CDC, in 2017, they reported that 49% of Hispanics had private insurance covered, 37% had public health insurance, and 17.8% of the population had no insurance.
Due to the lack of access to regular and quality healthcare services, the Latino population suffers from several negative health outcomes that can potentially lead to mortality. According to the CDC, the leading causes of death in the Latino population is cancer and heart disease. These are both two chronic conditions that develop and worsen over time and are often diagnosed when they are very severe. Because Latinos do not regularly get checkups, these chronic diseases that can be prevented or detected at an earlier time are found when it is too late and cause death.
It is important to note that there is no federal, state, or local law which explicitly states that individuals without lawful immigration status cannot access healthcare services. Additionally, there are no laws that prevent healthcare providers from treating undocumented people or prevent health insurance companies from selling health coverage to them. However, many federally publicly funded health programs have eligibility criteria based on immigration status, meaning although undocumented individuals cannot buy healthcare insurance under the Affordable Care Act, they can still purchase their own private health insurance. However, most people who are in America without documentation work at jobs that don't pay well enough to buy health insurance, nor do those jobs provide health coverage for that matter. This, along with other issues mentioned previously, are why interventions are needed to help the undocumented. The most effective interventions that would work best for this population to gain access to health care are clinics that are low cost or free of charge, located near them, care provided in multiple languages, in this specific case Spanish, and healthcare with complete patient confidentiality so they can seek care free of worry. Fortunately, there are existing interventions that provide healthcare at a minimal to no cost that the undocumented can gain access to. As all the following interventions that will be mentioned are healthcare facilities and programs, they must provide absolute patient confidentiality to abide by HIPAA law. There is also a policy known as the ICE Sensitive Locations Policy, and the CBP sensitive locations policy that generally keep immigration law enforcement away from sensitive locations such as healthcare facilities so people can seek those services without fear. One such example are community health centers. Community health centers are located in and/or serve populations with limited access to healthcare that provide healthcare services with costs adjusted to the individual's ability to pay or are otherwise free. They are meant to be a safety net for those ineligible for insurance under the ACA, which undocumented people happen to be. In a 2014 to 2016 study conducted by the U.S. HRSA Uniform Data System, 31 CHCs located in highly concentrated immigrant and uninsured resident communities were observed, and it was found that the majority of CHCs saw increasing numbers of patients without insurance due to their status. According to the U.S. News and World Health Report, there is a nationwide network of about 1,400 community health clinics that provide free basic health services such as dental care and preventative services, regardless of immigration status. I'll provide an established example of one in the Los Angeles County later on in this video. Another kind of health clinic that offers a specialty health service the undocumented can access is a widely known organization called Planned Parenthood. Planned Parenthood is a nonprofit organization with health centers across the nation providing sexual and reproductive health care to everyone regardless of income, insurance, and immigration status. It provides services on contraception, family planning, and reproductive health. Individuals who seek care with them are not required to give status documentation or a social security number. Patients can simply say they do not qualify for insurance and can ask about their options. As of August 2019, they have 20 locations in the Los Angeles County. Although there are no stats on exactly how many undocumented patients they have seen, their 2017-2018 annual report states that they gave care to over 120,000 patients within that year. They have staff who speak Spanish at several of their centers, which helps to overcome that language barrier patients may experience. There are also temporary pop-up clinics that undocumented individuals can refer to. Those are clinics that may partner up with local providers, schools, government agencies, and other organizations to provide various specialties of healthcare. For one or a few days, they'll convert large venues into clinics to treat hundreds of individuals who are uninsured, underinsured, and underserved in communities. Clinics like these provide patients who need follow-up care referred and connected to medical homes like CHCs for continuous care as well. One example is Care Harbor in Los Angeles. Every year, the pop-up clinic is comprised of many UCLA physicians, dentists, ophthalmologists, and student volunteers to provide exam screenings and treatments without income, insurance, or documentation requirements for entry, all completely free of charge. In their 2017 report, 2,132 patients attended their 3-day event, with 312 patients connected to clinics for continuous care. The total estimated cost they were able to provide for their patients reached nearly $2 million. They were able to encompass cultural competence by providing translators for those who weren't fluent in English. Another pop-up clinic is Lastonic Free Clinic Health Fair in Orange County. They host a number of free health fairs throughout the year. No documentation is required to attend the fairs as well, and provide the same health services such as general medical, dental, vision, and preventative care. The Lastonic Free Clinic also has permanent locations for health clinics with a number of services. In 2018, they reported providing medical and dental care to 10,672 patients at their locations, which are spread throughout the Los Angeles, Orange, and San Bernardino counties. Another service in the Los Angeles County area is a widespread, no-cost, comprehensive healthcare program available to low-income individuals and families who don't have and can't obtain health insurance. This includes the undocumented. Their services are provided by nonprofit clinics spread across the LA County that the program has partnered up with, who are known as community partners. There are over 200 clinic locations, with the majority of them offering their services in Spanish, which undocumented Latinos can ultimately benefit from. Their website provides a map to help find an MHLA community partner clinic in the Los Angeles region in which patients can enroll into that program if those clinics are accepting new patients. MHLA offers primary, preventative, diagnostic healthcare. In 2014, 135,000 individuals out of the estimated 400,000 uninsured in the county received healthcare through the program. The program estimated that they could accommodate another 145,000 patients to benefit from it, so that a total of 280,000 uninsured individuals, regardless of status, could receive care from them. Although these are only a few mentioned, these facilities and programs are effective interventions that help undocumented Latinos and the undocumented population in general overcome barriers to access healthcare.